Hello. People are going to start coming in. Hello, hello, hello. I'm sure there are people in here. I can't tell if there are or if there aren't, but I'm hoping there are. And if you are here, I would love to know what state you are from and what your role is. So if you can start populating the chat with what state you're in and what your role is. Hello, Debbie and Chasey, Yancey. We've got a whole bunch of people here today. Hello, hello. We're going to just start in a couple of minutes. We're going to give everybody a chance to flood on in. And then we're going to talk about some great stuff. Liza from Western New York, a new center owner. Liza, woo, congratulations. New Jersey, Head Start. Andrea, hello. A California site supervisor, Rochelle, hello. Debbie from Mass. Noemi from West Palm Beach, Allison, Executive Director, Brenda, a Quality Improvement Coach. Boy, do we need more of you. Ashley from Texas, an owner. Stacy from Maryland, an owner. Rhonda from Texas, a registered home provider. Keeping it real. Rhonda, Spotsylvania, Virginia. I don't think I do. Don Kreisberg, hello, I know you. And now you're in Baltimore. Hello, Don. Wow, I haven't seen your name in a while. And Deb, Business Development Specialist. Lindsay from Colorado. Hopefully starting a preschool next year. Well, Lindsay, you're in the right place because Playground knows how to help you do that. Wendy from McKinney, Texas. Maria from Texas. Hello, hello. We're going to start in just a minute. We're going to have a poll come out in a second. Amanda, Erica, hello, hello. We've got some interesting information, some interesting statistics for you as well today. Some of the stuff that I looked up for you all today kind of blew me away. I didn't know some of these percentages and numbers were so big. All right, I am going to get started. And as people are walking in, I know that they are also recording this. So if you miss any of this, you can always ask for the recording. Playground's really good. My team here, Emma and Harmony, are in the wings. They are going to help do everything. I know there will be some polls coming out as well, so keep an eye out for those and participate if you can. But I do want to start. My name is Tamar. Hello, everybody. And I live both in California and New Jersey. I am a bi-coastal early childhood person. I was a preschool director forever. I'm only 20 though. And now I am a full-time consultant and professor in early childhood. And so what we're going to be doing today, by the way, just to kind of give you an idea, is we're going to look at the federal funding landscape, where dollars are flowing and what's changing. The second thing that we're going to do is we're going to tackle the insurance crisis. And yes, there is an insurance crisis that is hitting childcare providers nationwide. The third thing we're going to look at is key legislation moving through Congress and state houses. And finally, we're going to examine how universal pre-K expansion is reshaping the childcare market. Finally, and this is just kind of on the aside, we're going to look at some specific state spotlight certain state initiatives that are happening. And then finally, we'll have a Q&A. So we're going to save the questions till the end, but if you have any of these, make sure that you put them in the chat because our wing people, Emma and Harmony, are going to be looking at those and helping me with those as well during this whole presentation. So the first thing I want to talk to you about is the national landscape. And the national landscape, this one blew me away. Did you know that there are almost 4.5 million children today that do not have access to childcare, either because of the childcare costs or because of the childcare deserts, because there are areas in this country that don't offer childcare. So for those of you looking to open up childcare, you might want to start looking at where those deserts exist. There is a child care development block grant that is given federally. This year, they upped it by about $85 million. It was at 8 million, and now it's at about 8.8 million, which might sound great, $85 million. But I will tell you the problem is that that is actually not going to take care of all the problems that we currently have in childcare. Head Start also got almost $12.5 billion more. And the preschool development grant, which is birth through 5 program, also got a little bit of money, 315 million. But when you're talking about the whole country, not that much. And it's the system that supports childcare in the states. But here's what's noteworthy, and I want to point this out. 23 states just received new grants, and that's important because new grants means that federal legislation is listening to us, listening to the issues that we have, the gaps that we have, and all of these, the 23 states got anywhere from about $500,000 to $15 million each to work on coordination, mixed delivery systems. Whoops, sorry, I'm knocking my table over. All of these kinds of things.
Interrupt you real quick?
Sure.
Okay. I think, first of all, I'm not sure if people are seeing the slides transition. So are you able to click through to the slide you're on?
I can click through. Sure. There you go.
Amazing. And so sorry, folks. My name is Emma Chaves. I run marketing here at Playground. Just stepping in real quick. Wanted to run a really brief poll to start things off just to see who we have here in the room representing us today, and then we'll get right back to everything.
I told them there'd be polls.
All right, awesome. Okay, it looks like we have a lot of representation from faith-based family childcare. Awesome. Some independent private centers. Okay. A very normal spread. Love this. All right. Tamar, I'll let you get back to your thing. Thanks everyone again for joining, and we'll pop in a little later.
And Trisha's here from Tribal Child Care Center. Trisha, I just did a webinar last night for the California Tribal Child Care.
All right. Tamar, which slide are we starting off, just to make sure?
No, we're actually going, now we're going to the next one. So we're going, there we go, the national landscape. We're going to go right there. Is that okay?
Awesome.
Okay, great. So I want to just share with you a couple of things as we get into this. As I said, almost 4.5 million children lack access to childcare. There are also some significant policy reversals happening. By the way, states are moving back to attendance-based billing instead of enrollment-based. What that means is that it used to be that if you got federal or state block grant money, that you would get money based on how many children were enrolled in your center. We are moving back now to attendance-based billing, which means that you're only going to get money for the children that actually show up and are, kids in seats. And that's important because what that means is that if a child is sick, or if a family goes on vacation, or for some other reason a child isn't there that day, providers might not get paid for that slot, and that could affect your bottom line. So that is one of the things. And by the way, this is not necessarily a webinar on how to advocate, but I will tell you this. That should be something, and you'll have my information afterwards, but that is something that you need to fight for. It needs to be enrollment-based billing rather than attendance-based billing, because those of us in early childhood know better than anybody else that kids in childcare get sick all the time, or they have ear infections, or they go on vacation, or somebody didn't want to get up and make them go to school that day because it's preschool. And so you can't necessarily fill those slots, right? Because that child has that slot reserved. And so we need to get our legislators back to giving us enrollment-based billing and not attendance-based billing. The other thing too is that advanced payments are no longer mandated, so cash flow cushions might be disappearing. The next thing I also want to talk about is, and I'm going to skip slides. Some of these things you guys can read on your own, so I don't have to read them for you. But federal funding, we talked about all of this money that people are getting. I'm going to keep going. We're also going back to parent-directed vouchers, and as a result, payment volatility. Oops, did I do that? No. My face just kind of went up. I don't know what I did. Payment volatility. And this is important because, especially in childcare, where our margins are not that big, right? You might, on the entire amount of money, your gross income, you might be able to eke out 5 or 6% as a margin of some kind of profit. Some of us also have faced years where we've run at a deficit. So when we have all of these things going back to some of these old ways, and there's this payment volatility where you don't know how much money you're going to get every month, that not only affects your bottom line, but it also affects teachers, families. It might affect enrollment and everything else. So it's important that we know how to advocate for ourselves. Pandemic relief dollars were exhausted December 31st. So many of you might already be feeling the fact that now in 2026, we are feeling the effects of all of this. Many analysts are calling this now the tipping point. In some states, you're also seeing closures and reduced capacity as relief dollars dried up because we really relied on that money to keep ourselves operational. In other states like New York, New Jersey, Maryland, which we'll talk about a little bit later, you're seeing very aggressive state reinvestment in universal systems. And as a result, there is a huge growing geographic inequity. And what that means is that you're living in increasingly, like where you live is going to increasingly determine whether you have access to affordable quality care or not. So for example, Mayor Mamdani in New York City is advocating free childcare across the board to anybody that lives in New York City, regardless of income or any other status. But if you live right over the bridge, right, in any of the towns, right over any of the bridges, and you're not in New York City itself, you might not have access to that free childcare. And so as a result, where you live could really heavily determine what your childcare looks like. And for many families, childcare is the second biggest expense they have after living, rent, and mortgage. So you might see people also moving geographically in order to take advantage of some of those programs. I want to talk also about insurance. 80% of providers are reporting higher premiums. With some centers, the increases are up to $10,000 per year or more. Some carriers, some insurance companies are withdrawing completely from some areas and are getting out of the child care business. And it's getting harder and harder. And we know that when there's not a lot of competition, rates for services go up. Family child care right now are some of the most vulnerable cases in the market for insurance. And so what this means is that family child care providers are being hit the hardest, and they are often the ones that families choose because their rates are a little bit lower. There's no membership fees the way there might be with faith-based programs. Some of their hours are a little bit more flexible, et cetera. And they're facing the outright denials, the steepest rates, et cetera. And what you don't realize is that this is a hidden cost crisis. I want to highlight that. It is a hidden cost crisis, and it's forcing some providers towards closure. And this is important to know. And so here are some solutions. I don't want to just give you the problems and not give you the solutions. So what we're looking at is there are some solutions being developed. One of them is called a risk pooling model. And what this means is that this is similar to what public schools do. And what this means is that in several states, what they're looking to is to create group purchasing arrangements. So for example, it might be that you contact an insurance provider, especially for those of you home daycare providers where you belong to a network, and you arrange for purchasing in bulk from an insurance carrier. And it's called a shared risk pool. You can also negotiate much better rates. So for those of you family childcare providers that are on here, you might want to start exploring that in your communities. And why it's called risk pooling is because it spreads the risk across many programs. It's not like fire insurance, where if there's a fire, everybody in a neighborhood is affected. Generally speaking, when there's a claim against a child care center, it's generally an isolated one. So if an insurance carrier can say get 20 or 30 or 40 home child care providers to all sign up at the same time, the likelihood of all of them having a claim at the same time is so little that their risk is decreased, and you can negotiate better terms or get insurance altogether. The National Governors Association and the NAEYC are also developing frameworks for states to set up some of these systems. And if you are a member of the NAEYC, they have companies that they work with. So if you are not yet a member of the NAEYC, it might be a good idea to explore that as an option because they're already piloting this shared coverage solution. And if you're a director of either a state-funded or a private, nonprofit, or faith-based program, it's something to ask your state association. So the California Association for the Education of Young Children, the Maryland, et cetera, or your resource and referral agency. By the way, I gave both Hannah and Harmony a whole list of resources. They will put those later on into the chat, and you can cut and paste those resources for yourself. Let me go on to the next slide. By the way, if there's another poll, stop me at any time, Hannah or Harmony. I want to share with you, they're already putting some of these in. There you go. There are some of your resources that I've found for you guys. HR 581 is the Child Care Workforce and Facilities Act. This bill would create Health and Human Service grants that cover up to 50% of the cost of constructing or renovating child care facilities in areas with that insufficient supply. So remember, we shared about the 4.5 million children who don't have access to childcare. It also includes workforce development grants. That means that workforce development grants are things that support you, the people who actually work in childcare. So this could be covering tuition or professional development, things like that, maybe covering the cost of CPR, mandated reporter training, et cetera. Again, legislators don't know if these things are important if you don't make a note of it to them. So find out who your federal elected officials are and just send a quick email saying, hey, I hear that HR 581 is going through Congress. I want you that I would love to hear that you support this. And the more constituents that they hear from, the more likely it is that this is going to be voted on. By the way, this is not a partisan bill. This is a bipartisan bill. This is a bill that both the Democrats and the Republicans want to have happen. But again, money is tight. It's only going to go where they think their constituents want it. So it's something that's important for you to vote on and for you to raise your voice about. And it's significant. Why? Because facility costs, building or renovating any kind of childcare spaces to meet licensing standards, are one of the barriers that most of you will have towards expanding supply in rural or low-income places, or if you've got a low enrollment in your pre-K and you want to maybe expand to infant and toddlers, which requires you buying, cribs or other kinds of materials, separating yards. These kinds of grants could be make or break for some of your programs. The Supply Tax Credit Act, here's another real good one. This bill proposes a business tax credit that covers 5% of the provider's wages, or 7% in rural areas, including wages that are paid by family child care homes. The goal here would be to stabilize compensation without raising costs for families. So what that means is, instead of you having to raise tuition by 5%, they would give you 5% back of whatever you are paying in wages. That's huge. I want you to realize that that's huge. Because if families are told, hey, we're not raising costs, but teachers are told, we can still raise your salary by 5%, those teachers might stay with you. And right now we're looking at a 40% turnover in childcare. So 5% could be the make or break for many of you guys. And this is one to really watch closely because workforce shortages are the #1 constraint in expanding capacity right now, not being able to find teachers to actually work in our programs. The next one is HR 6312, the Tri-Share, and I love this. What this is, there's a program in Michigan that was so successful. By the way, shout out to the owners and people who work at Constructive Playthings. They are part of the board of directors that initially got this going. And what this means is the following. The government would pay, right, from 3. The government would pay for 1/3 of the child care cost. Big businesses that these families work for would pay 1/3 of the child care cost, and the family would be responsible for the other third. Imagine if a family was told you only have to pay 1/3 of our cost for tuition. That's huge. It's also huge because it shows an investment on the part of big businesses, right? Saying, hey, we want to keep you employed. We know that it's hard to find childcare. We're going to help pay for your childcare, not taking away any of your salary. It's also huge because it shows a large investment by state governments, showing us finally that they see that childcare is necessary for the economy and the economic growth of our country. So I love this Tri-Share pilot program. This is something to really look forward to. I love partnerships. I love when everybody sits at the table and says, how can I help out? And then actually puts their money where their words are and does this kind of stuff. So I think this is really exciting. Again, send an email or a note to show that you are behind this. And then let's talk about UPK, the elephant in the room. It's not going to be the elephant in the room anymore. We're going to talk about it. So UPK, Universal Pre-K. It had some very huge benefits. We saw maternal employment up by 2.5%, right? Because this was something that was an economic benefit to families. We saw almost 11.5 more hours of weekly care. We saw parents' earnings increase by 22%, and it boosted overall employment and business formation. Anytime we can get money circulating in the economy, anytime we can get families back into the workforce and money changing hands, that means more money and more work for you all, meaning more children in those seats, which was really important. I will share with you, like anything else, there are always detriments and benefits. So those were the benefits. The other benefits were it was a complete reconfiguration that we're seeing in the market. Many 3- and 4-year-olds are shifting to this free public option. Let's face it, folks, if it was you, you would be doing the same thing, especially if they all go together with their friends. Many of the states are also requiring their 3- and 4-year-olds teachers who might have come down from 5th and 6th grade teaching assignments to now actually take child development classes. So there is improvement as well in the UPK. And so what that means then is that private centers are now more dependent on having those and toddlers, but it's hard. Why? Because if I've got a 4-year-old class, I could have 15, 18 kids in that class. But in the infant and toddler classes, I am limited in many of the states by how many children I can actually have in one group. As a result, it's much more expensive to operate those infant toddler programs, sometimes harder to find teachers to staff them, and parents don't want to pay double, even though I only have half the number of children in an infant class than I would have in a pre-K class. And if there's not mixed delivery funding, meaning that the governments are not paying for those children's UPK spots in your school and you're closing, it means the funding is absent. And so now we're losing out on that small little profit margin that we had to run our centers. In states where UPK expansion actually doesn't include mixed delivery funding, meaning public dollars are not flowing into the pre-K that you have maybe in your program, closures and consolidation, especially in small communities, And faith-based centers, I mean, closures are happening pretty quickly. So here is the enrollment trends that we are seeing. Now, this was when the latest numbers were collected in 23 and 24, but we know that UPK enrollment is definitely going up. And we also know that enrollment of 3 and 4-year-olds in private, for-profit, nonprofit, faith-based community centers is actually going down. And as a result, the states that are most affected by this are California and Colorado. 22 states are now seeing fewer enrolled children than they had pre-pandemic. We know that during the COVID pandemic, enrollment dropped significantly, and we are going back to even lower numbers than we had prior to the pandemic, which is pretty hard on a lot of people. And so what's happening now is you've got to adapt. Here's where you can actually adapt. So as I said before, focus on the infant and toddler specialization areas, extend hours, have wraparound services. The school that I was director of, even before the pandemic and now especially, how about Friday and Saturday night childcare so families can have babysitting, childcare when they need to go out, offer longer hours, do partnerships with districts, see if you can host a UPK in your program, offer it so that when it is offered, when they are looking for mixed delivery, you are there and ready. You might also want to look into being a Head Start provider. There's a lot of funding in Head Start, and have niche pedagogies. So for some faith-based, they are still marketable because families are looking for those faith-based or cultural programs. Families are also looking for STEM-focused programs. I've been crisscrossing the country. Many schools are now getting into these STEM focuses. By the way, if you need a STEM class, there are several universities that I teach for that we offer a STEM-focused early childhood course, and things like Montessori or Reggio, play-based, et cetera. All of these niche pedagogies are fantastic. The other thing that you also want to do is get together with your other schools in your area and see who has an overrun. There might be schools that are very small and can't handle the number of children that are requesting service at that particular child care center. See if you can be where they send their overflow to. And then I want to do, we're going to do a quick poll. So which age group represents the largest portion of your enrollment? And if you can, I'm just totally curious. See how many people in this are actually affected. And you can keep, I'm going to keep talking, but you can put that in there. There you go. So this is actually interesting because you'll see that most of you have 3 to 4-year-olds. By the way, that trend about 10 years ago would have been about 68 to 73% were preschool age. And infants would have made up only 5% of child care centers across the country 10 years ago. Interesting, because now you'll see again how this is shifting. Fascinating. All right, so I'm going to do a little state spotlight, New York, because New York has been in the news quite a bit lately. Again, Mamdani and Governor Hochul, they are moving towards universal child care statewide. By the way, it's very interesting to note that in 2026, Governor Hochul announced a move and that she would give $500 million to expand seats and increase per pupil funding to at least $10,000 per child. So if your tuition right now is $10,000 or less, that's fantastic. But if the tuition in your program is $16,000, who's going to cover that other $6,000? It'll either have to be families or it won't be universal child care. Another spotlight is New Jersey, where I'm from. And New Jersey is actually also pretty interesting. The state's allocated not a half a billion, but 120 million. So it's about 20%, a little more than 20%, 22% of what New York is offering. And these grants are for construction, facility expansion, and renovation of pre-K classrooms. But there is a lot of mixed delivery right now in New Jersey. Some of it quite successful, some of it not so, but they have a very explicit mixed delivery system. The next state is going to be Maryland. And Maryland is also pretty interesting because Maryland has offered a third model. The state is awarding pre-K expansion grants to both local education agencies and private providers to extend high quality pre-K access to 3 and 4-year-olds. Families earning up to 300% of the federal poverty level. So that's for a lot of families. 300% of the federal poverty level is a pretty high number. So there's a high threshold here. And so a lot of families are going to do it. There's also, I love it because in Maryland, they've given a strong role to private providers, which is really fantastic. And then the next thing is state licensing. There are states that are loosening standards. So for example, Iowa and Kansas are now allowing kids as young as 16-year-olds to have less supervision. And you can be only 16 years old to work in childcare. Idaho has increased the child to adult ratios. And what they're basically saying is we can't find qualified childcare workers, so we're going to lower the qualification bar and we're going to allow you to have more children per teacher. While that might be great for owners, it is a trade-off. It's a quality versus access trade-off. And I got to tell you, there's a very strong argument for both sides. And I see that. There are also states that are cutting back on subsidies. So for example, Indiana and Arkansas are cutting their reimbursement rates. Some states are increasing family copays, and some are creating a 2-tier system. I'm going to kind of quicken this up so I can get through my stuff. We have one last poll. I'm going to talk through this poll, so just fill it out while I'm talking, just to see how many of you are dependent on public funding. And again, I'm going to talk through this poll. But there is a workforce crisis that still persists. 92 to 94% of the workforce is female for several reasons. Number one, it has just traditionally been a female-heavy workforce. Number two, many childcare providers are a little hesitant as a result of certain taboos or stereotypes of men in the workforce. 40% of the people who work in childcare are people of color, and wages are still 23% lower than other equal fields. There is also a 3% projected job decline for the upcoming decade, meaning that there will be 3% fewer jobs in childcare as we still continue to see closures, et cetera, and turnover. And here's our poll results. So right now, 25% or less of our revenue comes from any kind of federal or state funding. Most of you show that you really rely more heavily on tuition and other sources of income, which is quite interesting. Enrollment pattern shifts. Again, we discussed this. There is still a strong demand for childcare, but it is shifting to the ages that are trending a little bit younger. Private centers are going to have to concentrate much more on infants and toddlers as those seats for UPK kids go to the publicly funded. And we also see the desert versus the oasis geography emerging, meaning that there are areas where there is a concentration of childcare, and then there are areas that are still a childcare desert. The cost trends are also the average cost for infant toddler care in family-based homes is about $18,500. That is a almost 80% increase since before the pandemic. That is huge. And most Americans still cite cost as a major concern. As I said, it is the second highest thing that families pay for outside of housing, and costs are reshaping family planning decisions heavily. What does this mean for all of you? It means that you have to diversify your revenue. Do not hold back. Start looking into infant toddler care, alternate hours, pursue those UPK contracts and Head Start contracts. I would go after the Head Start as well. Specialize in underserved ages and hours. Explore insurance pooling. I would also check with resource and referral. Check with your local school districts to find out, because many children go to school districts to get tested for special needs, and special needs has their own kind of funding in many states. So for example, in California, you have something called the regional centers, and they will often pay for enrollment in private childcare if there are not enough seats in their public childcare special needs programs. And keep monitoring those state bills that affect licensing and funding, and send those emails out to your elected officials. Watch for scholarships and credentialing programs, workforce development grants, and advocate for wage parity, right? We're still paid 23% less than equal jobs with the same kinds of education requirements. Advocate in your state. And I've got a list of places that you should follow. The links have been put into the chat for any of you that want to find those. And this is my information. I am Tamar Andrews. There's my cell phone number, my email address. I am happy to help support anybody that wants more support in the field of childcare, early childhood education. It has been an honor and a pleasure to share the last 36 minutes with all of you.
Thank you so much, Dr. Andrews.
Right on time.
And I would love to take a second for people to put some questions in the chat. As those questions come in, or as they don't, I'll just move on to a few closing remarks. So I just want to make sure we all know how we're here currently on this webinar with Dr. Andrews. You may have heard of Playground, but more importantly, you may have heard of Dr. Andrews' two sons. Daniel and Josh Andrews grew up in the preschool of 250 kids that Dr. Andrews ran. Their grandma was a preschool administrator, and their aunt ran an in-home program. They've grown up completely within the preschool. They've seen the administrative struggles up close. Dr. Andrews asked them to build a tool to handle contactless attendance, digital paperwork, because the tools she was using at the time weren't working. And so fast forward 5-6 years later, word of mouth got out, and the tools that Daniel and Josh built for Dr. Andrews have now been used by hundreds of thousands of providers, families, childcare professionals nationwide. And we are delighted that we can continue to give back to the industry that has given so much to us. What is Playground? Playground is an all-in-one childcare management system. It manages everything that your business or growth management might need: enrollment, CRM, payroll, billing, attendance, much more. Truthfully, the reason why folks and Playground get along so well is less so the software is really good. Dr. Andrews can attest to that. She pretty much designed it and asked for it. But it's really the fact that we serve as a growth partner. Folks come to us because they want a technology consultation. They want to do a discovery call. They want to understand, how is their program actually operating well, and where are the parts of the program that could use a little streamlining. So if you want to have an introductory conversation with someone on our team, just do a little bit of a walk through a technology stack, scan right through, or click on that button to sign up for a chat with someone on our team, and we'll be sure to reach out. Thank you so much for your time. Okay, we do have a couple of questions. I want to give the microphone back to Dr. Andrews to discuss.
So I want to address Callie's question about declining enrollment and lowering birth rates. Again, there are 4.2 million children who need childcare that don't have it. And what we need to do, number one, is really advocate for those mixed delivery systems. Right now, kindergarten through 12th grade is completely funded by the government. And the teachers that work in those programs make a lot of money, a lot more than we do as child care workers, right? Why is it that child care, which are the critical years of development, are not treated the same as K through 12? Imagine if the federal government and state legislators understood the importance of preschool, right? That 0 to 5 age, and treated it with the same amount of respect and funding that they did K through 12. That is what we need to advocate for. And on top of that, preschool 0 to 5 should be housed in our high quality childcare centers, not in institutions that are K through 12, because those kids are much different biologically, much different cognitively than our preschoolers are. So what we have to do is we have to keep educating our legislative bodies to understand that they need to fund 0 to 5 in the same way that they fund K through 12, but house them in the same way that we do now, in these high quality, loving, nurturing environments. And there is a future for private preschools, Paula, in the age of preschool for all. But that is what I'm talking about. I'm talking about keeping preschool as sacrosanct, right? As this really holy time in a child's development, funding it the same way that you fund K through 12, but recognizing that it has to be housed in what we have been doing, where we have been educated as to the best practices in early childhood. Mixed delivery disregards private preschools' operational methods, even those meeting. Yes. New Jersey, actually, yes, exactly. And that's because, so here's the problem, and this is both for Debbie and for Liza. By the way, Hannah, do you mind putting my slide back with my contact info? We really have to educate people. Imagine if we all got together and we all had a unified voice. I remember that there were different issues, that there was like the Million Man March in Washington, D.C. Imagine if we did that. Debbie, I'm in New Jersey. You have my contact info. I am more than happy to help you do this. I will share with you that Tennessee took away all of the funding that it had for workforce development. I don't know if anybody here is from Tennessee. And a few of my students got together and met with their state legislative body. Debbie, what we need to do is we need to go meet with our legislators in New Jersey. We need to hound them. We need to pound them into understanding that they're not going to get voted back into office if they don't do what we need them to do for childcare. Debbie, yes, child change makers. Oh, you've got to like trademark that name. A day without child, yes. And Debbie, it's not respected anywhere in the country. Childcare is not respected yet, not yet. But that is what we are trying to do. That is part of the reason why. And by the way, Playground also manages another set of webinars called Early Childhood Investigations. The whole goal of Early Childhood Investigations is to help train the workforce. It's free online, live, and recorded webinars to help educate the workforce. We cannot argue for higher wages and for a seat at the table if we ourselves don't educate ourselves. We have to hold ourselves to the same accountability that K-12 teachers hold themselves. Thank you. Yes, and there's my contact information. Again, that's my email and my cell phone. Big business owns most large corporate centers such as Goddard, Primrose, et cetera. Yes, there are some VCs, venture capitalists, and other businesses. But even, I have to tell you, even if big businesses own some of these large childcare centers, that doesn't mean that we still can't advocate for high quality in those programs, right? Those big businesses that own childcare, they don't want the government to take away the children from their seats. So we can advocate with those big businesses the same way that we advocate with the legislator. And by the way, those big businesses, they've got more money to spend on advertisement and lobbying these legislative bodies. So work with them. Don't think you have to work against them. Work with them to make these changes that we need. Debbie,
right.
where are you in New Jersey? I'm so curious, Debbie. Where in New Jersey are you? Because I live in Englewood. I would love to have coffee with you one day.
Dr.
All
Andrews,
right.
I believe we are at time. So another huge thank you. And thank you to everyone for being here this afternoon.
Thank you. Thank you. Thanks for hosting us.
Of course. Take care.
Bye.
See you at the next.